Have you ever felt that quiet moment of uncertainty when a word like preparedness sounds heavier than it should, almost as if it is warning you that something bad is coming? Many older adults tell me they feel that way, even though they are simply trying to take good care of themselves. One of my patients once shared something that stayed with me. She said, "Doctor, I hear about being prepared all the time, but I do not want to live my days feeling afraid." What she was really asking was not about illness. She was asking how to stay calm, steady, and dignified while growing older. I want you to imagine this for a moment. Imagine preparedness not as emergency sirens or alarming headlines, but as a gentle rhythm, waking up at the same time, knowing your body's patterns, trusting that you understand when something feels different, and knowing who to ask without panic. I am Dr. Evelyn Carter, and on Senior Health Daily, we talk about health in a way that protects your peace of mind. Today, we are exploring a simple but important question. Nipah virus preparedness. Are seniors truly ready? Not ready in a fearful sense, but ready in a grounded, confident way that honors the aging body. In my years of caring for older adults, I have learned that preparedness begins long before any illness appears. It lives in routine, awareness, and emotional safety. As we age, our immune system responds more slowly and sometimes less predictably. That does not mean weakness. It means the body needs clearer signals, more patience, and steadier support. Science tells us that aging changes how the body handles stress and infection. Experience tells us that calm understanding helps the body cope better than urgency ever could. Being prepared does not mean something bad is coming. It means you are listening to your body with respect and trusting the systems designed to protect you. If this feels helpful so far, please like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue creating calm, trustworthy guidance made especially for you. In the next part, we will talk about what preparedness truly looks like for seniors and how readiness can feel reassuring instead of overwhelming. What preparedness really means for seniors. What does preparedness really mean for seniors? I ask this question often because many older adults hear the word and feel an immediate tightening in the chest. Preparedness can sound like alarms, emergencies, or something to brace against. But in my years of caring for older patients, I have learned that true preparedness is much quieter than that. Preparedness begins with routine. It lives in the small, steady patterns of daily life. Waking up around the same time, eating familiar foods, taking medications as prescribed, noticing how the body usually feels on an ordinary day. When these rhythms are in place, the body and mind feel grounded. That sense of grounding is one of the strongest forms of protection we have as we age. I once cared for a gentleman in his late 70s who told me he never worried about illness, yet he always knew when something was off. He said his secret was paying attention to his normal. When his sleep changed, when his appetite shifted, or when his energy dipped in an unfamiliar way, he did not panic. He simply asked questions and sought guidance. That is preparedness, calm awareness paired with trust. Many seniors assume preparedness is only about rare events or major health crises. In reality, it is about staying connected to yourself. Aging bodies respond differently to stress and infection. Reactions may be slower. Symptoms may feel subtle. That does not make seniors fragile. It means the body communicates in softer ways. Preparedness helps you listen without fear. From a medical perspective, routine also supports the brain. The aging brain thrives on predictability. Familiar schedules reduce confusion and support memory. This is especially important for those living with mild cognitive changes or early dementia. When life feels orderly, the brain has more energy to manage challenges. Preparedness also means knowing who to turn to: a trusted doctor, a family member, a healthcare system you understand. It does not mean having all the answers. It means knowing where to ask questions when something feels different. I have seen seniors become more confident once they understand this shift. They stop feeling on edge and start feeling capable. Preparedness becomes a source of reassurance rather than worry. At its heart, preparedness is an act of self-respect. It says, I know my body. I honor its signals. I move through aging with patience and dignity. That mindset creates calm readiness, not urgency. And calm readiness is what truly protects senior health. How aging changes the body's response to infection. As we move through later life, our bodies continue to adapt in quiet and complex ways. One of the most important changes happens in the immune system. I like to explain this gently because understanding it helps seniors feel informed rather than concerned. When we are younger, the immune system tends to react quickly and forcefully. It recognizes unfamiliar germs and responds with speed. As we age, that response becomes slower and sometimes less precise. This is not a failure. It is a natural result of a system that has worked hard for many decades. The immune system has memory, experience, and wisdom, but it may take longer to mobilize its defenses. For older adults, this slower response means that infections can develop more quietly at first. Symptoms may not appear right away. Fever may be mild or absent. Fatigue or confusion may show up before anything else feels wrong. I have often seen seniors say they felt off, not sick. That feeling is important. It is the body's early language. The immune system can also stay active longer than necessary once it is triggered. This can lead to lingering inflammation, which places extra stress on the body and especially on the brain. In seniors, inflammation can affect energy, attention, mood, and sleep before more obvious signs appear. This is why early preparation matters more later in life. Preparation does not mean expecting illness. It means understanding how your body now communicates. It means noticing patterns. When your normal rhythm changes, when recovery feels slower, or when tiredness feels unfamiliar, those are signals worth respecting. Early preparation allows you to respond before small issues become harder to manage. From a caregiving perspective, I have seen how early awareness protects dignity. Seniors who understand their bodies feel more confident speaking up. They do not wait until discomfort becomes distress. Families who understand immune aging are more patient. They give more time. They listen more closely. The science behind immune aging also explains why routine is so important. Regular sleep, balanced meals, hydration, and gentle movement support immune balance. These habits do not prevent every illness, but they give the body a steadier foundation. A steady body responds better to stress. Early preparation also builds trust. Trust in your own awareness. Trust in medical guidance. Trust that noticing change is a strength, not a weakness. In later life, preparation is not about speed. It is about steadiness. When seniors understand how aging changes the immune response, fear often softens. The body is not betraying you. It is asking for a different kind of care. Responding early and calmly honors that request and supports health with patience and respect. Why rare viruses still deserve calm awareness. When people hear that a virus is rare, there is often a sense of relief, followed by dismissal. I understand that response. Rarity sounds reassuring. It suggests distance and safety. But in healthcare, rare does not mean irrelevant, especially for older adults whose bodies respond differently to stress and infection. Calm awareness is not the same as worry. It is a steady way of staying informed without carrying fear. In my years of practice, I have seen that seniors who understand this distinction feel more grounded. They are not expecting illness. They are simply ready to listen to their bodies and respond thoughtfully if something feels different. Rare viruses matter because they often behave quietly at first. They do not always announce themselves in dramatic ways. In older adults, early signs can blend into everyday changes like fatigue, slower thinking, or altered sleep. When something is uncommon, it is easier to overlook these signals or assume they must have another explanation. Awareness helps prevent that silence. Preparedness is not about anticipating a specific virus. It is about strengthening your ability to notice change and know what to do next. Think of it as keeping the lights on in a familiar room. You are not waiting for trouble. You are simply making sure you can see clearly if something shifts. I once cared for a woman who told me she did not follow health news because it made her anxious. Over time, we worked on a different approach. Instead of avoiding information, she learned to frame it through calm readiness. She paid attention to her routines. She trusted her instincts. When she felt off in a way that did not pass, she reached out early. That approach brought her peace, not fear. From a scientific perspective, rare viruses teach us something important. They remind us that the body does not always respond in predictable ways. Especially in aging immune systems, symptoms may appear subtly. Awareness allows for earlier support, which often leads to better outcomes and less stress on the body and mind. For seniors, readiness means having a relationship with healthcare, not waiting until something feels urgent. It means understanding that asking questions early is a form of self-care. It also means families feel more confident supporting loved ones without overreacting. Calm awareness respects dignity. It does not label you as fragile or at risk. It acknowledges experience and wisdom. Seniors have lived through many changes and challenges. Preparedness honors that resilience by pairing it with gentle attentiveness. Rarity should never lead to indifference. At the same time, it should never lead to alarm. The middle ground is where health lives best. Being ready does not mean expecting the worst. It means trusting yourself to respond wisely if the unexpected ever appears. The role of routine in health, preparedness routine, is one of the most powerful forms of preparedness I have ever seen, especially in later life. It does not look dramatic or medical. It looks ordinary. And that is exactly why it works. When the world feels uncertain, routine gives the body and mind something steady to lean on. Our bodies remember patterns. Waking at a familiar hour, eating meals that feel known, moving gently through the day in expected ways. These habits create a sense of safety inside the nervous system. For older adults, that sense of safety is not just emotional, it is physical. When the body feels grounded, it responds to stress with more balance and less strain. I have cared for many seniors who told me they felt better simply by keeping their days predictable. One woman shared that when her routine slipped, everything felt harder. She slept poorly. Her appetite faded. Her thoughts felt scattered. When we worked together to restore simple daily rhythms, her clarity slowly returned. Nothing dramatic changed. Consistency did. From a medical perspective, routine supports the immune system. Regular sleep helps regulate inflammation. Consistent meals support energy and blood sugar balance. Gentle daily movement improves circulation and brain function. These habits do not prevent every illness, but they help the body respond more smoothly when something unexpected appears. Routine also protects emotional safety. Uncertainty can make the aging brain feel unmoored. Too many changes at once can increase confusion, anxiety, or withdrawal. Familiar patterns act like signposts. They remind the brain where it is and what comes next. This is especially important for seniors living with memory changes or early dementia. Routine reduces the mental effort required just to get through the day. During times when health concerns arise, routine becomes even more valuable. I often tell families that keeping small things the same can make a big difference. The same morning greeting, the same chair by the window, the same music in the evening. These details communicate stability when the body feels unsure. Preparedness through routine is not about rigid control. It is about kindness toward yourself. It allows flexibility without chaos. When something feels off, routine helps you notice it sooner. You recognize when sleep changes, when appetite shifts, or when energy feels unfamiliar. That awareness supports earlier, calmer responses. What I want seniors to hear clearly is this: you do not need to overhaul your life to be prepared. You only need to honor the rhythms that already support you. Routine is not boring. It is protective. It preserves dignity, supports health, and offers reassurance during uncertainty. In times of calm, routine builds strength. In times of change, It provides comfort. That quiet steadiness is one of the greatest gifts you can give your aging body and mind. Emotional readiness matters as much as medical readiness. When we talk about preparedness, it is easy to focus only on medical facts and plans. But in later life, emotional readiness is just as important as medical readiness. I have seen time and again that how a person feels emotionally can shape how their body responds physically. Anxiety places a quiet strain on the nervous system. For older adults, that strain can affect sleep, appetite, memory, and concentration. When worry lingers, the body stays on alert, even when there is no immediate threat. Over time, that constant alertness can make recovery harder and fatigue deeper. This is why reducing anxiety is not a luxury. It is part of good healthcare. Emotional readiness begins with reassurance. Seniors need to know that preparedness does not mean something bad is about to happen. It means they are supported and not alone. I often remind my patients that planning calmly is an act of confidence, not fear. When the mind understands this, the body often relaxes. Preserving dignity is essential. Health planning should never make someone feel weak or dependent. Older adults have spent a lifetime caring for others, solving problems, and adapting to change. Preparedness should honor that history. It should invite participation, not impose decisions. Asking for input, listening carefully, and respecting preferences all reinforce a sense of control and self-worth. From a caregiving perspective, emotional readiness also means allowing space for feelings. Some seniors feel uneasy talking about health risks. Others worry about becoming a burden. These feelings are normal. A calm conversation, held without urgency, helps release that tension. When emotions are acknowledged, they lose their power to overwhelm. Simple science supports this approach. When people feel safe and reassured, stress hormones decrease. Lower stress supports immune balance, clearer thinking, and better sleep. Emotional safety helps the brain and body work together rather than against each other. I have watched seniors grow stronger simply by feeling heard. One gentleman told me that once he understood preparedness as a shared process rather than a personal failing, his anxiety eased. He slept better. He felt more capable. Nothing about his health status changed, but his outlook did. That shift mattered. Emotional readiness also supports families. When seniors feel calm and respected, loved ones feel less pressure to push or control. Care becomes more collaborative. Communication improves. Decisions are made with clarity rather than urgency. Health planning should never strip away dignity. It should reinforce it. Preparedness that includes emotional readiness creates steadiness. It allows seniors to face uncertainty with grace, patience, and trust. When the heart feels settled, the body is better equipped to respond to whatever comes with resilience and calm. Before we go any further, I want to take a moment to acknowledge something important. Conversations about health preparedness can feel very personal. They touch on independence, vulnerability, and the hope of continuing life with steadiness and dignity. If you are still listening right now, that tells me you care deeply about yourself or someone you love. That care matters. Over the years, I have learned that seniors often feel most supported when they know they are not navigating these questions alone. Community does not have to be loud or demanding. Sometimes it is simply the comfort of hearing a familiar voice explain things calmly. Sometimes it is knowing that others are quietly learning alongside you, asking similar questions, and finding reassurance in the same place. This is why Senior Health Daily exists. It is meant to be a steady space where information does not rush you or overwhelm you. It is a place where health is discussed with patience, respect, and trust in your life experience. Preparedness, as we have been talking about, grows stronger when it is shared. When understanding is collective, fear has less room to grow. I have seen seniors feel lighter once they realize they are part of a larger conversation. They begin to understand that asking questions is not a sign of weakness. It is a sign of engagement with life. Caregivers often tell me they feel more confident knowing they have a resource that speaks gently and clearly, without pressure. If this video has helped you feel more grounded or more informed, I want you to know that your presence here makes a difference. This channel continues because people like you choose calm understanding over urgency. Your attention helps keep these conversations accessible for others who may be feeling uncertain or alone. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Engagement is not about numbers. It is about connection. When you subscribe, like, or share, you help create a quiet network of support. Someone else may find this information at just the right moment, when they need reassurance more than answers. As we continue together, remember that preparedness grows stronger in community. Shared understanding brings confidence. Calm voices create steadiness. You are part of that steadiness simply by being here, listening and caring. How health systems prepare for older adults. When people hear about health systems and preparedness, it can sound distant or complicated, as if it all happens somewhere far away. I want to bring this closer to you because public health readiness is not an abstract idea. It is a network of people, routines, and coordination designed to quietly protect older adults every day. Health systems prepare by planning ahead, even when there is no immediate problem. Hospitals, clinics, and public health teams share information, practice response plans, and make sure communication channels stay open. For seniors, this coordination matters deeply. Aging bodies often need clearer guidance, gentler pacing, and more continuity of care. Preparation helps ensure those needs are met without confusion. One of the most important parts of readiness is trust. When systems work well, seniors know where to turn. They recognize their clinic. They understand how to reach help. They feel confident that if something feels off, someone will listen. I have seen how calming this trust can be. Patients who feel connected to their healthcare system often seek care earlier and with less anxiety. Coordination also means that different parts of care talk to each other. Primary doctors, specialists, hospitals, and public health agencies share responsibility. This reduces gaps. It helps ensure that older adults are not left repeating their stories or navigating complex decisions alone. For seniors, especially those with memory changes, this continuity protects dignity and reduces stress. From a scientific standpoint, preparedness allows health systems to respond thoughtfully rather than reactively. When plans are in place, care is delivered with steadiness. Testing, monitoring, and follow-up happen in an organized way. This is particularly important for older adults, whose symptoms may be subtle and whose recovery benefits from consistency. I often tell my patients that readiness does not mean expecting illness. It means systems are ready to support you if questions arise. This includes clear public guidance, trained healthcare workers, and protocols that prioritize vulnerable populations like seniors. Health systems also prepare by learning from experience. Past challenges shape better responses in the future. Seniors benefit from this learning because it leads to clearer communication and improved care pathways. Each lesson strengthens the network that quietly surrounds you. What I want you to remember is this: preparedness is not something you carry alone. It is shared between individuals, families, and the systems designed to care for them. When trust and coordination are strong, seniors feel safer. They feel seen and supported. Knowing that these systems are working in the background can bring reassurance. You are not navigating health concerns in isolation. There is a structure built to listen, respond, and care with patience. That knowledge allows you to focus on living your life with confidence, knowing support is there when you need it. Family and caregiver roles in preparedness. Families and caregivers play a quiet but powerful role in preparedness, especially for older adults. The most important part of that role is not control. It is communication. When families talk openly and calmly, preparedness becomes a shared effort rather than a source of tension. Good communication begins with listening. Seniors often know their bodies well. They sense when something feels different, even if they cannot always explain it clearly. When families listen without interrupting or correcting, they create space for those signals to be heard. I have seen many situations where simply being listened to reduced anxiety and brought clarity. Feeling heard supports emotional safety, which in turn supports better decision-making. Shared planning is another key element. Preparedness works best when it is done together, not done for someone. This means including the older adult in conversations about routines, preferences, and who to contact when questions arise. Planning together preserves dignity. It reminds seniors that they remain active participants in their own lives, not passive recipients of care. I often caution families about overprotection. It usually comes from love, but it can unintentionally increase stress. When every decision is taken away, older adults may feel powerless or infantilized. That emotional strain can worsen confusion, anxiety, or withdrawal. Preparedness should build confidence, not remove it. From my experience, the most supportive caregivers offer guidance without pressure. They check in gently. They ask how something feels rather than assuming. They support routines instead of constantly changing them. This approach helps the aging brain feel stable and respected. Caregivers also benefit from clear communication among themselves. When family members share observations calmly and consistently, patterns become easier to see. One person may notice sleep changes, another may notice mood shifts. Putting those observations together creates a fuller picture without alarm. Simple science supports this collaborative approach. Stress hormones rise when people feel controlled or misunderstood. Lower stress supports better immune balance, clearer thinking, and steadier emotions. When families work as partners rather than managers, the body responds more favorably. I encourage families to talk about preparedness during calm moments, not only during concern. These conversations are easier when there is no urgency. They allow everyone to express hopes, boundaries, and comfort levels. That preparation reduces confusion later and strengthens trust. Family and caregiver roles are not about doing everything perfectly. They are about showing up with patience and respect. Preparedness grows when communication is kind, planning is shared, and independence is honored. That balance protects not only physical health, but also the dignity and emotional well-being that matter so deeply in later life. Practical preparedness without overwhelm. Preparedness does not need to feel complicated or heavy. In fact, the most effective preparation I have seen in older adults is often simple and quiet. It grows out of small habits that reduce confusion and make it easier to ask for help when needed. One gentle step is keeping medical information organized in a way that feels manageable. This does not mean creating a large binder or memorizing details. It can be as simple as knowing where your medication list is kept, having important phone numbers written down, and keeping recent test results in one familiar place. When information is easy to find, stress stays lower, especially during moments when thinking feels slower. I often suggest choosing one trusted location for health information and returning it there each time. The brain finds comfort in consistency. When you know exactly where something belongs, you do not have to search or worry. That sense of order supports emotional safety as much as practical readiness. Another part of preparedness is knowing when to seek guidance. This can feel uncertain for many seniors. No one wants to overreact, and no one wants to be dismissed. I encourage listening to patterns rather than single moments. If something feels different and does not settle after rest or routine, that is usually the right time to ask a question. Reaching out early is not a sign of weakness. It is a sign of attentiveness to your own well-being. From my experience, seniors who feel prepared are not the ones who know everything. They are the ones who know who to call. A primary doctor, a clinic nurse, or a family member who understands your health history can help you decide what to do next. Preparedness is about connection, not self-reliance. It is also helpful to prepare emotionally for uncertainty. Health does not always move in straight lines. Some days feel clearer than others. That is normal. Giving yourself permission to slow down and ask for guidance reduces pressure. Pressure is what overwhelms. Calm curiosity is what supports clarity. Simple routines support this kind of preparedness. Regular check-ins with yourself. Noticing sleep, appetite, and energy. These quiet observations help you recognize when something is off without creating alarm. They also give useful information to healthcare providers if questions arise. What I want seniors to remember is that preparedness should lighten your load, not add to it. If a step feels overwhelming, it may be more than you need. Preparedness works best when it fits naturally into your life and respects your pace. By organizing information gently and trusting yourself to ask for guidance at the right time, you create readiness without strain. That balance protects both your health and your peace of mind, which are equally important as you age. Preparedness as a form of self-respect. Preparedness, at its deepest level, is an act of self-respect. It is not about guarding against loss or trying to control every outcome. It is about honoring the body that has carried you through a lifetime and recognizing the wisdom you have gained along the way. Older adults have lived through change, uncertainty, and recovery more times than they can count. You have adapted to new seasons, new roles, and new challenges. Preparedness draws on that experience. It says that your life has taught you how to notice, how to adjust, and how to care for yourself with patience. That is not fear. That is maturity. I often tell my patients that readiness is not about bracing for something bad. It is about standing comfortably in who you are today. When you keep routines that support you, when you organize information in a way that makes sense to you, and when you allow yourself to ask for guidance without embarrassment, you are practicing self-respect. You are acknowledging that your body deserves attention and kindness, not pressure. Many seniors worry that preparation means giving up independence. In my experience, the opposite is true. Preparedness preserves independence because it allows you to remain engaged in your own care. It keeps decisions collaborative rather than reactive. When you feel prepared, you are less likely to feel rushed or pushed into choices that do not reflect your values. There is also dignity in recognizing limits without judgment. The aging body may need more rest, more time, or clearer communication. Accepting that does not mean surrendering control. It means redefining control as cooperation with your body rather than resistance to it. That shift brings peace. From a caregiving perspective, I have seen seniors regain confidence when they reframe preparedness this way. They stop seeing it as something imposed on them and begin seeing it as something they choose. That choice restores a sense of agency and calm. Preparedness as self-respect also extends to how you speak to yourself. Replacing self-criticism with curiosity. Allowing room for uncertainty without shame. Treating yourself with the same patience you would offer someone you love. These emotional habits protect health just as much as physical routines. What I want you to carry forward is this understanding. You are not preparing because you are afraid of losing control. You are preparing because you value your life, your experiences, and your well-being. You are honoring the body that has supported you for decades and continuing to care for it with intention. That kind of preparedness does not weigh you down. It lifts you. It allows you to move through aging with steadiness, dignity, and quiet confidence. As we come to the close of this conversation, I want to invite you to slow down with me for a moment. Take a breath. Let your shoulders rest. Preparedness, when understood gently, is not something heavy you need to carry. It is a quiet form of care, an expression of gratitude for a body that has supported you through many seasons of life. Understanding does not mean danger is near. It does not mean you need to watch your health with worry or suspicion. It means you are listening to yourself with wisdom. It means you notice patterns, respect changes, and respond with patience rather than urgency. In my years of caring for older adults, I have seen again and again that calm understanding supports health far better than rushing ever does. Your body speaks in subtle ways, especially as it ages. Listening is not weakness. It is maturity. It is trust. Trust in your experience. Trust in medical care. Trust that you are capable of responding thoughtfully when questions arise. There is no need to remember every detail we discussed. Simply holding the direction is enough. I often encourage my patients to thank their bodies, even on days that feel uncertain. Gratitude settles the nervous system. Patience gives the mind room to breathe. When you approach preparedness this way, it becomes a source of steadiness, not stress. If at any time health topics feel heavy or overwhelming, remember that you are not meant to navigate them alone. Senior Health Daily is a steady place to return for calm guidance, respectful conversation, and reassurance grounded in experience. There is no pressure here, no fear, just quiet, reliable support. Thank you for spending this time with me. Your attention, your curiosity, and your care for yourself matter deeply. And whenever you need a calm voice to walk beside you, Senior Health Daily will be here.